Well, good evening, everybody. My name is Carly Schertino Poulter, and I'm the director of the ARC Advocacy Network here at the ARC of Indiana. And I want to welcome you to our Ask the ARC webinar series. Tonight, we're going to be talking about working and benefits. And in addition to being the director of the ARC Advocacy Network, I'm also a mom. I have an adult son with autism. And so I live this life too. And I know what it's like to try to adjust to that adulthood portion of life and try to help your child navigate all of that. And because October is Disabilities Employment Awareness Month, I thought tonight we should talk about employment and disabilities and working and benefits because we get all sorts of questions about working and benefits. And so I wanted to be able to answer some of those questions because the reality is there is a lot of misinformation when it comes to working and benefits. And there's also some old information. So I want to kind of go through and talk about how individuals with disabilities can work and actually maintain their benefits. Now, we are recording tonight's session, and we will be posting that on the ARC Academy, as well as on our YouTube channel. So I do want to encourage you to, as you're asking questions, to be a little bit careful in what you share. But by all means, go ahead and put some questions in the Q&A, and we will get to those as we go along. So let me go ahead and share my screen. So like I said, tonight we're going to be talking about working and benefits. And I hear all sorts of things when it comes to employment. I have heard things like, you can't work if you have SSI or SSDI or Medicaid or the waiver. Or if you work, you'll lose all of your benefits. Or you can only work part-time. Or you can only work in a sheltered workshop. One that got me once was, you can't make more than $85 per month or you'll lose everything. Not a single one of those myths is true. Every single one of them is false. And that's what I mean by there's a lot of misinformation out there. And it's well-intentioned. And it's certainly very easy to understand why there's so much confusion, because even the agencies who are in charge of some of these programs say things that they don't mean. For example, Social Security always says you can get SSI or you can get SSDI if you can't work. Well, that's what they say, but that's not what they mean, because you can absolutely work and still get SSI or SSDI. So those are the things we're going to get into tonight. And the number one question people always ask me is, how much money can my loved one make? When has there ever been a clear-cut answer involving anything with our loved ones? Why would this be any different? And so I'm a little tongue-in-cheek with that. But the reality is, how much money can my loved one make? Well, it depends. And it depends because different programs have different income requirements. And sometimes with some of these programs, there can be a difference between a person's eligibility and then the actual benefit that they receive. So let's start with Medicaid. Now, when I started this job at the ARC as a family advocate, I thought Medicaid was just Medicaid. I was wrong. Here in Indiana, we literally have 38 different types of Medicaid, and every single one of those types of Medicaid have their own exceptions, their own specific requirements, their own twists and turns. That's why it feels like you could never get a straight answer about Medicaid, is because every single one of those 38 categories has a different answer. So we're going to talk about the types of Medicaid that people with disabilities are more likely to have. And so first we're going to talk about HIP 2.0. Now, the irony here is that HIP 2.0 is what Indiana did for Medicaid expansion. And it is designed for people who are not deemed disabled by the Social Security Administration. Okay, we do have a lot of people with disabilities on HIP. Some of them are deemed medically fragile by Indiana Medicaid, but they're not considered disabled by Social Security. And so For an individual on HIP 2.0, as a single adult, they can make up to 138% of the poverty level, which means that this year in 2023, they can make $1,676 from all sources and have HIP 2.0. Now, as I'm talking tonight, it is October of 2023. And so we're using 2023 numbers. All of these will change in January. So I just want to throw that out there so that we're avoiding some confusion. I will also say this morning, the Social Security Administration announced their cost of living adjustment for 2024. I did not incorporate that into this presentation because I didn't want to cause confusion by dealing with numbers from two different years. So we're going to stick with 2023 numbers today. Now, one of the other categories of Medicaid that commonly people with disabilities have is Medicaid disability. And there are actually a couple of different types within that. There's Medicaid for people on SSI, and then there's Medicaid disability, which is typically designed for individuals who are in some form of institutional setting, whether that's a skilled nursing facility, whether that's a residential treatment center, whether that's supported group living, which is a group home, which typically has 6 to 8 people living in it. Those individuals can be on Medicaid disability, and they can make up to 100% of the federal poverty level, which for a single adult this year means they can only make $1,215 per month from all sources. So that means if they're getting $914 in SSI per month, they can only make $301 from some other source. Now, then we have Medicaid disability for people who are on the waiver, because when you have a waiver, it changes a ton of those Medicaid rules, especially those Medicaid financial rules. They have special income limits that apply to people on waivers. So individuals who are on the family support waiver, the CIH waiver, or the aged and disabled waiver can make up to 300% of the maximum SSI rate. In 2023, that means that they can make $2,742 per month from all sources. So between their Social Security and any job that they have. That's almost $33,000 a year. That's a good amount of income. So when you're on a waiver, you can make a lot more. Now, individuals who are on the traumatic brain injury waiver, that's not quite as good. You can only make half of that. You can make $1,371 per month in 2023 from all sources and have full Medicaid. But I've got a better option for you. There is a program called MedWorks. It literally stands for Medicaid for Employees with Disabilities. Essentially, the state of Indiana recognized that there were a lot of people with disabilities who wanted to work and who could work, but they needed the health coverage Medicaid offered so that they were able to work. So they allowed people with disabilities to essentially buy into Medicaid. That's what MedWorks is Indiana's buy-in program. There are some really cool things about MedWorks. First of all, you can make up to 350% of the poverty level from all sources, which means this year, as a single adult, you can make just over $51,000 a year and have full Medicaid. One of the other great things about this program is you can have retirement savings like a 401k or an IRA, and this type of Medicaid will not count it against you. Now, SSI still will, SSDI does not. So that's just something to keep in mind. Also, this type of Medicaid is waiver compatible. Not all types of Medicaid are. This one is. So if you are on a Medicaid waiver and you want to have a career, you want to make good money, you can always go on MedWorks so that you are able to do so. Now, if you're sitting there thinking, hey, Carly, what's the catch to this? This sounds a little too good to be true. That is because you have been around long enough to know to ask, what's the catch? And there are a couple. So first of all, you have to be determined disabled by the Social Security Administration in order to be on MedWorks. But If you work yourself off of Social Security benefits, there's a version called MedWorks Improved, and that's exactly what it was designed for. The other big catch is that with this type of Medicaid, you do pay a monthly premium, but your monthly premium is based on income. And as of right now, the maximum monthly premium for a single adult is $187 a month, and that's if you're making 51 grand. So it is certainly something that is affordable. Now, if someone is married, spousal income will count toward premium cost, but not toward eligibility. So MedWorks can be a great resource for a lot of people who want to work and want to be able to maintain their benefits. And it's something that a lot of people have just never heard of. In fact, a lot of times the Medicaid office is not familiar with this because there's so few people on MedWorks, they just don't deal with it very often. I promise you, MedWorks really exists, and it can be a great option for people with disabilities who want to work. So now let's talk about Social Security, because with Social Security, there is a difference between eligibility and monthly check. So let's focus on that eligibility piece, okay? When it comes to being eligible for Social Security disability benefits, there is both a medical component to it, but there's also a financial component to it. When most people think about Social Security disability, they only think that they're looking at your disability. They're not. They're also looking at the finances that go into this too. And specifically, Social Security is looking to see if you can engage in substantial gainful activity. Okay. If you can engage in substantial gainful activity, regardless of how substantial your disability is, as far as the Social Security Administration is concerned, you do not have a disability. In 2023, substantial gainful activity for most individuals is $1,470 per month in countable income. There should be a big neon flashing asterisk next to that word countable, because that's where all the details are. Now, if somebody is blind, according to the Social Security Administration, they have a different substantial gainful activity amount. Substantial gainful activity in 2023 for a person who is blind is $2,460 a month. So just want you to know that there's a difference there. Now, when I say that they're looking to see, can you make $1,470 a month? That's in countable income. A lot of people don't realize that, and they don't realize that Social Security can adjust down your countable income. What I mean by that is they can take certain expenses and certain work incentives into consideration to only count a portion of the money you make. So, for example, if you have impairment-related work expenses, money that you have to pay in order to maintain your job, they can subtract that from your countable income. If you have job accommodations that you need in order to work, they can subtract that. If you have employer subsidies, they can subtract those sorts of things. And we'll get into that here in more detail in just a moment. But those are all things that they can absolutely do. One of the other really important work incentives that is available are something called trial work experiences. And what that will allow you to do is it will allow you to earn as much money as possible in any 9 months out of a rolling 5-year period without losing your eligibility, so that people can try to work without putting their benefits in danger. Now, it doesn't mean that their benefit may not change, but it means they won't lose their eligibility. Okay. And one of the other big things I want to stress here is that does not mean 9 consecutive months. That means in any 5-year period, it can be 9 months at any point during that time. So I want to point that out as well. Now, with Social Security disability insurance, there's some different regulations there. And so now I want to talk about the monthly check, because SSDI amounts do not change based on a person's earnings. They're only looking to see if you can engage in substantial gainful activity. SSDI is an all or nothing benefit. So if you are not engaging in substantial gainful activity, you get your SSDI check. If you are engaged in substantial gainful activity, you do not get that SSDI check. SSI is different because SSI changes based on your monthly income because they are looking at your countable income, and then they subtract $20 from your general income disregard. They subtract $65 as an earned income disregard. Then they subtract any impairment-related work expenses, employer subsidies, and job accommodations. And then they subtract half of that countable income from your monthly check. Confused at this point? Yeah, it's because this is confusing. And that's why people are always afraid to work. They don't want to put their benefits at risk, and they can't get a clear-cut answer on how working will impact their benefits. So let's do an example. Let's start by trying to figure out how they figure out somebody's countable income. Now, this is just an example. And so we have Ben, who is a man with Down syndrome, and he bags groceries at Kroger. He works 25 hours a week. He works 5 days a week and makes $15 an hour. Well, when Social Security is trying to figure out, his countable income, first of all, they look at his monthly earned income, $15 an hour, 25 hours a week. And the weird part is Social Security always uses 4.3 weeks per month in their calculations, okay? So in this particular example, Ben is making $1,612.50 a month. Well, that's over SGA. And so most people in Ben's life, including all the professionals in Ben's life, would tell him, you've got to stop working so much or you're going to lose your benefits. You've got to cut back on your hours. Nonsense. We can absolutely cut down how much of that 1612 Social Security actually counts. So let's start. Well, Ben's bagging groceries. They know him. They like him. He's a great employee. Everybody loves him, his coworkers and his customers. But they know it takes Ben a little bit longer to do certain things. They're okay with that because he shows up every shift. He makes working there so much more enjoyable. They're willing to make that accommodation for him. Okay. Well, Ben is expected to get through 7 customers per hour, but a bagger without disabilities would be expected to get through 10 customers per hour. That's called a production level, and it's officially an employer subsidy. And in this particular case, it's a 70% production level because Ben is only expected to do 7 out of 10. So right off the bat, regardless of how much Ben actually makes, Social Security is only going to count 70% of it. Then they're going to subtract that $20 general income disregard. Then they're going to subtract the $65 earned income disregard since he's actually working. But because of Ben's Down syndrome, he does not drive. He has to take specialized transportation to get to and from work. And so he uses that door-to-door paratransit in his community. And that's $3 per ride. But he works 5 days a week. So getting to and from work, that's 10 rides per week at 4.3 weeks per month. Okay. Which means that Ben is spending $129 out of pocket each month just so he can maintain his job. That's called an impairment-related work expense because that is money that he is paying out of his own pocket to maintain his employment. Okay. But let's say Ben also has a job coach. He's got a job coach that comes in for an hour a week just to check on him, make sure things are going smoothly, work out any kinks that may be happening. Well, Social Security has a formula for job coaches, and what they do is they look at the individual's hourly rate, and that's what they use to subtract the cost of the job coach. Well, in this case, he sees the job coach 1 hour a week. Ben's making $15 an hour, so that's the rate they're going to use for it at 4.3 weeks per month. So that job coach, as far as Social Security is concerned, costs $64.50 a month. So we take that $1612.50 that Ben is actually making, we multiply it by 70% because of his production level. We subtract the $20 general income disregard. We subtract the $65 earned income disregard. We subtract the $129 that he is spending in transportation costs, which are his impairment related work expenses. And then we subtract the $64.50 for his job coach. What that means is, even though Ben is making $1,612.50 a month, Social Security is only counting $850.25 of that amount. So then that is his countable income. That $850.25 per month is his countable income. So Social Security will divide that by 2, because for every $2 you earn, your SSI check goes down by $1. So that means that they are going to reduce his SSI check by $425.12, half of his countable income. So then we take that maximum SSI rate and we subtract that $425.12 per month. That means Ben's monthly check is going to be $488.88. Now, a lot of people get really nervous. They're like, his SSI went down. Okay, yeah, his SSI went down, but he's also making over $1,600 a month. So between that $1,612.50 that he's actually making and his $488.88 that he's getting from his Social Security, Ben's total monthly income is $2,101.38. He's making a whole lot more money than he's losing, because the truth is, you will always make more money by working than by not working. Now, I'm going to pause here for just a moment to check to see if we've got any questions in the question and answer section, because I know that part gets really confusing. So if you've got questions, by all means, go ahead and put those in there. I'm not seeing any at the moment, so I'm going to go ahead and go back and keep talking. But by all means, put your questions in the Q&A. Now, when it comes to determining those work incentives, that's where all the details are. That is how you are able to work more while having a smaller impact on your benefits. We've got a question that has come in. So Jan is asking about something called 1619B, which is another version of Medicaid for people who have disabilities who are working. So when you have somebody, say, who's on a waiver, and they make more than that 300% of SSI, so they make more than $27.42 per month, Medicaid will try to put them on 1619B, and they can make up to, it's around $33,000 at that point. Here's the thing. I think MedWorks is a whole lot better, because while you can make more money with 1619B, they're going to count that all as a spend down. So let's say, for example, you made $300 more than the maximum waiver amount. Okay, you made, instead of making $27.42, you made $3,042 a month. Okay, they can put you on 1619B, but what they're going to do is they're going to make you spend that $300 on your medical expenses before your Medicaid kicks in. I don't know about you. I love my job, but I don't do it for free. That's why I'm not a huge fan of 1619B, is basically you're making more money, but you're not allowed to keep any of it. Well, what's the point of that? So that's why I actually encourage people to skip 1619B and really fight to get on MedWorks, because then you actually get to keep your money. And Jan, I am so grateful that you went ahead and brought that up, because that is something that people will often talk about. I just think MedWorks is a better option for people, because they actually get to keep the money that they make. So thank you for asking about that. So a lot of the details in making sure that you can earn as much money as possible comes down to determining and documenting the work incentives that you need in order to work. And so one of those things is, if you are working with a job coach, if you have an open VR case, talk with your job coach. to help determine that. A lot of people with disabilities don't necessarily recognize what types of impairment-related work expenses they may have, what types of job accommodations their employer may be providing, or what types of employer incentives they may be, or employer subsidies they may be getting. A job coach will have a better idea of that. And you can also assess the direct work expenses that you have that are related to your disability. So some examples of that are things like transportation costs, especially if you're not able to drive due to your disability. If you have medication costs associated with your disability, and I know that during the pandemic, those have all been halted because Medicaid has not been charging any copays. Those will start again here probably next year. And so if you've got anything that you pay out of pocket so that you are able to work and is related to your disability is an impairment related work expense. Now, let's say, for example, that you have to buy a uniform to work. Well, normally that uniform doesn't have anything to do with your disability. Everybody's got to pay for their own uniform. Well, that's not an impairment related work expense because it had nothing to do with your disability. But things like those transportation costs can be. If you are able to drive yourself and you're thinking about your gas costs and all that, well, that's something that everybody would have. But if you have to take paratransit to get to and from work, or you have to take door-to-door transportation, those are transportation costs that can absolutely be considered an impairment-related work expense and be subtracted from that countable income. But you also want to assess the supports that are related to your disability that may be paid by others. And that's not something that Social Security will, directly discusses, but it's something that can be considered. So, for example, if you have attendant care or you have PAC services and you're using those to help you get ready for work, those are absolutely things you want to document, just like you would document the job coach. You're not paying for the job coach, somebody else is paying for it, but it is essential for you to be able to have in order to work. If you work with a behaviorist or you work with a mental health team, so that you are able to handle the stress of your job or the anxiety that may come with it, or so that you don't punch a coworker, those are things that Social Security can absolutely consider in determining your countable income. And then also assessing what your employer provides. And sometimes people don't always recognize what that is. So for example, if you have additional supervision, if you take more breaks, if you take longer breaks, if you have a modified schedule so that you are able to work, maybe they know that you can only work part-time because working, 8 hours a day is just too much. That's an adjusted schedule. And so those are things that Social Security will absolutely take into consideration when determining your countable income. Production level is another huge one. That's a way to really adjust that countable income. Those are things that a lot of individuals don't know how to document on their own and don't necessarily know how, what to identify on their own. So talk with your job coach, but then also talk with someone called a BIN officer to help you with that. So a BIN officer stands for Benefit Information Network. Okay. And this is a program through the Social Security Administration, or is paid for by the Social Security Administration. It is available through vocational rehabilitation services. And what they do is they look at an individual's specific Social Security file to figure out all the different types of work incentives that may be available to that individual. Now, their goal is to help people work off of benefits. And if that is your goal, I fully support you in that. If that is not your goal, I fully support you in that. Okay. But, BIN officers can be really, really helpful in all of that, and also helpful in identifying some other resources that many people just don't know about. If you are working with VR, you can request to have a consultation with a BIN officer. If you are not working with VR, there are two agencies that also provide that BIN analysis. If you're in central or northern Indiana, it's Indiana Works WIPA, which is through Aspire. And if you're in southern Indiana, it's through an agency called SERS. But a lot of provider agencies, whether it's employment providers or even some waiver providers, have been trained liaisons who work for them. And so sometimes you can also just ask to informally consult with them to help you identify what work incentives you may already be using and how you can document those things. So, but of course, it's great to know how much money you can make. We also want to save money. We want to save money for the things we want in life, whether that's, buying a house or going on vacation or buying a computer. We want to be able to save money, but we've got to do it in a responsible way that doesn't put our benefits in jeopardy. And so there are several ways to do that. And one of the biggest ones is something called a special needs trust. Now, the nice thing about a special needs trust is you can put an unlimited amount of money in a special needs trust, and neither Social Security nor Medicaid will ever count it against you. Now, money in a special needs trust can be used for almost anything. If a person is on SSI, they can't really use it for food or shelter without it being considered an in-kind support, and it messes up your SSI. I've also recently learned that you cannot use money in a special needs trust to purchase alcohol, firearms, or to gamble. I just thought it was funny and like I said, I just recently learned that one. So I wanted to share that with you. The thing is, with a special needs trust, the money in a special needs trust can only be used for the sole benefit of the individual. So if you're living in a house with 3 other people and you need a new couch, your special needs trust can only be used for 1/4 of that couch because that is your fair share of the cost. Okay. So that's something to consider. If the money deposited into a special needs trust belongs to the person with a disability first, any money left in that trust after their death will go back to Medicaid to reimburse Medicaid for the cost of their care. That's called Medicaid estate recovery. Okay. If the money deposited belongs to someone else, let's say mom and dad or grandparents start a special needs trust and put money into that special needs trust, the people who established that trust determine where any leftover money goes. Okay. Now, granted, part of this is I work for the ARC, so I know people who do things that the average person doesn't do. But I've got a couple of colleagues who both have special needs trusts, and they're using it for very different reasons. So I have one friend who is already thinking about retirement. And yes, she's on MedWorks, and yes, she has a 401k, but she's also putting money into her trust every month so that when she's ready to retire, she wants to buy a place in Florida and live on the water where it's warm. So, so she puts money every month into her trust to be able to accomplish that. Then I have another colleague. He is putting money into his trust because he is saving up. He wants to have his own home theater system. So he is putting money into his trust so that he can afford that. Because that's not something that you can just, that you can just have that money available for in most situations. It's something you've got to save up for. And by putting that money into a special needs trust, they can each accomplish that. Then there's also something called ABLE accounts. And the information I'm about to share about ABLE accounts is accurate right now. And the reason I say it like that is there are some changes coming to ABLE accounts in 2026, but that's still several years away. So let's talk about how ABLE accounts work right now. Right now, in order to open an ABLE account, you had to sustain your disability prior to age 26. And if you're wondering, Carly, what's magical about the age of 26? Absolutely nothing. It was what Congress could actually compromise on when they passed ABLE legislation. There's no magic to that particular age. Now, with ABLE accounts, you can put up to $17,000 per year into an ABLE account from all sources. And one of the ways that a special needs trust and an ABLE account are different is that the individual with a disability and their family can put money into the same account. They have to be in separate accounts with special needs trusts. But you can put up to $17,000 a year into an ABLE account. And you can have up to $100,000 in that account. And Social Security nor Medicaid will count that as an asset against you. Anything over $100,000, they count as an asset or as a resource. But up to $100,000, they do not. Like I said, multiple people can contribute to the same account. But one of the big differences is that when it comes to an ABLE account, the money in an ABLE account can only be used for a qualified disability related expense. Now, they include basic living expenses in that, but so you can use your ABLE account to pay your rent. But if you want to save up money to go to Disney World, because going to Disney World has nothing to do with your disability, you cannot use it. You cannot use your ABLE account to pay for that vacation. It's also important to know that any money left in an ABLE account when the individual passes away, regardless of who put that money in, goes back to Medicaid to reimburse Medicaid for the cost of the individual's care. Now, one of the other ways that people can save money, and this is one that not very many people have heard of, but is amazing, is something called an individualized development account, or IDA. Now, the cool thing about IDAs, they have absolutely nothing to do with disability at all. IDAs are designed to help people get out of poverty. And so the money that you put into an individualized development account has to be tied to a goal of getting out of poverty. So that could mean saving money for a down payment on a house. That could be saving money for a car so that you can get to and from work easier. That could be saving for education or some sort of training program. But you have to have a goal tied to getting out of poverty. But here's why it's so great. For every dollar you put into that individualized development account, the state of Indiana will match it with a minimum of $3 up to $4,500. So it's a quick way to actually build up a good amount of savings to help you achieve your goals. Now, in order to be eligible for an individualized development account, you have to be below 200% of the federal poverty level. You have to be working, and you have to take a financial literacy class. But here's the thing. They're essentially paying you to take that financial literacy class, so go for it. But it's a great way that people can quickly save up money for whatever their goals are. Then we have some other specialty type accounts. We have a plan to achieve self-sufficiency, or a PASS account. We have property essential for self-support, or a PES account. That's designed for people who may own their own business, and they can put money into that PES account so that when they need to buy new equipment for their business, they can do that. That money in that account is safe and not counted as an asset against you, so that you can purchase that. So, for example, let's say you've got somebody who has started their own lawn mowing business. Well, they can put money into that property essential for self-support, or that PES account, so that when they need repairs on the lawnmower, when they need to replace that lawnmower, when they want to buy a second lawnmower, they have that money already ready for them, and it's not being counted against them because it's essential for their business. There are other types of specialty accounts, and that's where talking to a BIN officer can really help, because there are a lot of just really niche things out there that may be able to help people with disabilities work and maintain, or even work off of their benefits. And some people do want to work off benefits. That is their goal. And if that is your goal, like I said, I fully support you in that. But you want to make a deliberate plan so that you can be successful in that. Okay. So you start by deciding which benefits you want to work off of. If it's that waiver, what you need to do is work on the skills that you have staff helping you with, so that you no longer need those staff. That's identifying natural supports and community resources that can help you with the things you need. That's potentially identifying technology that can help you, and connecting with your local center for independent living. If somebody's wanting to work off of Medicaid, make sure you have other health coverage, or that you're considering MedWorks or MedWorks Improved, so that you have the medical care that you need. And then if your goal is to work off of Social Security benefits, work on putting money into an approved account like a special needs trust or an ABLE account until you're able to live off of your earned income only. So like I said, I've got a friend who's planning on retirement. So it's not that she's wanting to work off of her Social Security benefits. It's that eventually she wants to retire. And when she retires, she's no longer going to have her employment income. So she's got to be able to live off of her Social Security benefits, whether it's those disability benefits or by the time she retires, it'll actually be retirement benefits that she would be living on. And so she's got to get used to living on that smaller amount of income each month. So part of what she's doing is putting money into that special needs trust, not only so that she can, buy that property in Florida when she's ready to retire, but also so that she's not used to having that additional money, not used to living off of that additional money, so that when her employment income goes away, she's already used to living off of that smaller amount. Um, but at the same time, when it comes to Social Security, if somebody wants to work off of Social Security, but something happens, maybe they have a health setback, maybe they lose their job, maybe their company goes bankrupt and the job goes away. Social Security also has something called expedited reinstatement, so that if you're within a certain amount of time, you can go back on Social Security in a quicker way. Okay, they still do medical reviews, they still do certain things, but it fast tracks it, essentially. So I want you to know that that is also an option, especially if you are trying to work off of these benefits. There are a few safety nets that are still there available for you. So at this point, I want to open it up to questions. What questions do you guys have? By all means, go ahead and put those in the question and answer section. I'll give you a few moments to type. So, but I know that this information gets confusing. And like I said, a lot of times if somebody is getting close to, the income limit for a certain program, a lot of times what will happen is even the professionals in their lives will say, oh, you've got to cut back on your hours. Oh, you've got to work less, because they don't want to put those benefits in jeopardy. Well, a lot of times there are ways that you can continue to work and continue to make more money. You've just got to know how to document it, because the whole world revolves around paperwork. And that's how individuals are able to work and maintain their benefits. So what questions do you have? I know it's just awkward that I'm sitting here waiting for questions. So, silence is one of those things that bothers me. I can't help it. I'm not seeing any questions at the moment. Um, if you're typing, please keep typing. But here's the other thing. If you have questions, by all means, give us a call here at the ARC. Talk with one of our family advocates. But I also really want to make sure that that you are also consulting with some of the other experts that could be in your life, whether that's talking to a BIN officer, talking to a BIN liaison with your employment agency, talking to your job coach, so that you can find more information and find ways to help you work and maintain your benefits. So we've got a couple of questions that are coming in. Will the Social Security app for reporting wages ever let you have two jobs? You know what? I think that's an excellent question, and I think it's something that they're just not used to yet. Will it ever happen? Potentially. I have no idea when. So what she's talking about is when you are on Social Security benefits, you're actually required to report your wages every single month. Now, in the old days, you had to either take it into the Social Security office, call and give them that information, or fax it in. The good news is that now you can actually report those wages online. You can do that through opening a My Social Security account, and you can report those wages directly. She also had a follow-up question. Can IRWs be reported on the app? Not yet. You still have to report those IRWs, those impairment-related work expenses. Those things you have to report either by fax or by taking them in directly. You know, to me, if you have the ability to just pop into the Social Security office and report them, I would rather do that, because I'm a little nervous that sometimes those faxes get lost along the way. But you can actually just fax that information into them as well. Somebody was asking if I would ever come to a small group of parents and inform them about this. Absolutely, I would. Because again, I'm a fellow mom. I live this life too. And I want to make sure that people with disabilities have all the opportunities that are available to them. And so often people don't know what those opportunities are. When you're looking for a job, do you ask for a bin officer first? Is there someone that would help with keeping the documents? Those are great questions. Yes, if you are working with vocational rehab, you can absolutely ask for that bin consult first. Um, and if you don't have Social Security yet, you can also request to talk to them. Although it might be a little bit easier if you're working with voc rehab and you have an employment specialist, maybe talking to their bin liaisons first. And I'm using slightly different terms there. What I mean by that is a bin officer is somebody who has gone through extensive training. Sometimes you have employment agencies who have what are called bin liaisons, where they have taken some of the training, but not necessarily all the intensive training that a formal bin officer may. But they can still be a really good resource for you. So yes, you can do that. Is there someone that would help with keeping the documents? That's really going to wind up being on you to keep that documentation. Okay. One of the other things that can also be available is there are certain forms that Social Security also has. One of them is called an employer subsidy form. Now, it's a great form to be able to document the types of support your employer provides. Sometimes, though, you've got to have that conversation with your employer to let them know that it's okay first, because sometimes employers are afraid that they're doing something wrong by doing things like, letting somebody have more breaks or giving them less responsibilities or having those production levels. They're afraid that they're doing something wrong. And you need to reassure them, no, no, no. Not only are you doing something right, the federal government wants you to be providing those types of supports to people with disabilities. And there are actually tax incentives available for companies who do that. So sometimes you gotta give those employers permission and let them know that it's okay for them to fill those out. Social Security also has something called a work activity report. Now, I will tell you that report is like 12 pages long and it is thorough. Okay, it's long, but it's also a great way that where they can break down certain questions when it comes to employment and what types of supports and what types of uh, incentives you're getting to work, and it's a way that you can document some of those things and also document some of those less obvious supports. So things you're not necessarily paying for, but things like the job coach, things like the attendant care, or things along those lines that may be essential for you to be able to maintain your job. And that's another key piece to this, is that it's not just about somebody getting a job. Sometimes we're needing to document the types of things that somebody needs in order to maintain their job. And that is also just as important. My daughter with a disability has a UTMA account set up by her grandparents. She is now 21. Is this account taken into consideration when establishing her benefits? I'm going to be perfectly honest. I don't know that answer. I'd have to do a little bit of research to figure out what a UTMA account is. That might be talking with some of my colleagues here at the ARC and just doing a little bit of research. But that's something we can absolutely do. So if you want to give us a call at the ARC of Indiana and talk to one of the family advocates, we can look into that for you. Frankly, I'll probably start looking into that as soon as we're done tonight. But I have no way of getting you the answer. So give us a call and we can talk about that. Okay. When we were talking about those, how to document those impairment related work expenses, and I said that you could fax them in. The person followed up with, I mail mine in each month, and you can absolutely do that too. Somebody's asking if we are going to make the presentation and slides available, and if so, where can they find them? We are absolutely going to put this presentation online. We're going to put it on our YouTube channel, but then we'll also put it on the ARC Academy. And yes, we'd be able to put the slides on there as well. So I'm glad you asked that too. So are there other questions that people may have? You guys have had some really, really good questions. I'm glad to see the questions that we've got on here because I know that this gets really confusing. And it's hard to find some of this information. So I'm glad you asked those things. But here's the other thing. If you have more questions, if you are anything like me, you will think of something 3 weeks from now. Give us a call at the ARC. Talk with any one of our family advocates. We will gladly talk with you about your specific situation and help you find the information that you need. So, so with that all being said, next month, oh, we've got another question that has just popped in. Oh, somebody was just saying thank you. So thank you, and thank you so much for joining us tonight. I will say that next month, our Ask the ARC webinar is going to be focused on bringing in that next generation of support because, well, it's November, it's Thanksgiving. People are going to be coming home for the holidays, and so we're going to talk about how do you have those conversations so that when something happens to you or when you start needing some help in supporting your loved one, how do you bring in that next generation? How do you have those discussions? How do you make it so that it's not scary, so that it's approachable? And so those are the things we're going to talk about next month in Ask the ARC. Got one more question that may have popped in. So just again, somebody's saying thank you. So thank you all so much for joining us today. I hope to see you next month for Ask the ARC on bringing in the next generation of support, and have a wonderful evening. Bye-bye.